Well, hello there. It's Christopher Westfall here with an update for 2022, what's going to be happening with Medicare. Now, as I record this, it's still October 2021, so we have some new updates coming in the first week of November. At least that's what traditionally happens. The first week of November, we find out what the Part B deductible will be for the next year. We find out what the Part B premiums will be that everyone has to pay every month, the deductible for high deductible plan G and high deductible plan F, et cetera, et cetera. We find those things out in November. And so make sure you come back to our updates page to get the latest information on what's happening with Medicare and Social Security. You can always find that page at seniorssavingsnetwork.org/update. That's seniorssavingsnetwork.org/update. So now we're coming into the annual enrollment period, otherwise known as the annual election period. Now, this is a big part of Medicare where these Medicare Advantage plans have one single period of the year that you can do changes in order to avoid what they call adverse selection. And that is, you waited with no insurance and all of a sudden you need something done. You're going to run out and get insurance. They don't want that to happen because that would adversely affect everyone. So they set aside this certain time of the year called the annual enrollment period where you can go in and sign up or change your Medicare Advantage plan. Now, how does that pertain to you if you have a Medicare supplement plan? Not at all. If you have a Medicare supplement plan, you can change those plans any time of the year. As a matter of fact, 365 times a year, you can change which company you have your Medicare supplement plan with. That's Plan F, Plan G, Plan N, and so forth. This time of the year is only for Medicare Advantage plans, and that's where the priority tends to go because we have over 50 million people that are running in to make changes on not just Medicare Advantage, but also the Part D drug plan. Because most people don't know this, but the Part D drug program is actually under the umbrella of Medicare Advantage. You'll notice that when they have prior authorizations and all those things necessary for the expensive drugs and the different tiers and the one time a year to sign up for it and change. So if you have a Part D drug plan or want one, or you have a Medicare Advantage plan or want one or want to get off of one, that's what this period of time is for. Again, if you have a Medicare supplement, everything's going great. You can just leave it alone and we can help you all through the year as your rate comes up for renewal and to save you money there. The next thing that's going to happen after this season's over, now this season runs from October 15th through December 7th, my birthday, Pearl Harbor Day. That's the end of the annual enrollment period, October 15th through December 7th. Now you are picking your plan for, again, Medicare Advantage, that's HMO or PPO or MSA, those plans, or a drug plan, a standalone drug plan. You can't have both, by the way. It's either one or the other. Whatever you choose during this period will take effect and kick in January 1st of the next year. But that's not the end of the story. Now we've had a return of the disenrollment period that will start next year. It starts at the beginning of every year, and now it's January 1 through March 31st. That's called this is so strange. They call it the open enrollment period, but it's not. It's not open. It's not where you can go do anything you want to. No, that period of time from January to March 31st of every year is if you got on a Medicare Advantage plan and you figured out this plan is not for me. And what we typically see with experience in here is people calling in and saying, look, I was on a good Medicare Advantage plan for me, and then they changed it. They changed all the benefits. I never knew it. I didn't pay attention to what was happening because they send this notice of change. I didn't see that notice, and oh my gosh, I need to get off this plan and get onto another plan. That's what that period is called. It's the do-over period, I call it. But Medicare calls it the open enrollment period, which is just so confusing. We're talking about the period of time that you can change what Medicare Advantage plan you were on. We'll talk about that as we get toward that period of time to make some clarity there as to what your options are. But just needless to say, the first period that comes up is the most important, the annual enrollment period for both Medicare Advantage changes or Part D drug plans. So, what do you look for? Well, here's an example. My father-in-law got this annual notice of change in the mail from his plan. This was from Humana. And you really, really have to look at that plan. If you have a Part D drug plan, this is critically important. If you have a Medicare Advantage plan, even more so. Because every year, those plans, both the Medicare Advantage and the Part D drug plans, they can change. They can change drastically. What we're seeing a lot this time, and I've got a detailed analysis of that on our drug plan site, which I'll give you the resource for, But what we're seeing a lot is changes in the formulary. That means what drugs are covered now that weren't covered before, or what were covered before are no longer being covered now. And then drugs are moving their tiers. That is, the amount of money that you're paying for those drugs is changing, sometimes quite significantly. We also have plans that are participating in the insulin savings program. That's the senior savings program, and that's not a knock on our trademark on Senior Savings Network, but they just happen to call that the senior savings program. That's for people who are on diabetes, and certain plans are participating with certain types of diabetes medication, the insulin, to cap it at a maximum of $35 per month, which is great. Long time needed. That happened under the last administration. So there are a lot of changes happening with your Part D drug plan and Medicare Advantage. The best thing you can do right now, is look at your annual notice of change and decide, is that the plan that I still want to stay on? Again, that's for your Part D drug plan. You really need to look at it, or your Medicare Advantage plan. Now, a lot of people don't get this in the mail. Why don't they get this in the mail? Because when they checked out or they did an enrollment for their Part D drug plan, for instance, they signed up for electronic delivery of documents. That means they sent you an email. And that's it. That's the only notice you're going to get. They sent you an email, and that email might have gone to a spam folder or junk folder, something like that. If that happened, you've got to go research what happened to that email, that notice, and pay close attention to what those changes are. Now, what they do, they try to make it simple. They put what you had for last year, what you're used to, and then what the potential changes are this year in their categories. I would encourage you, though, little inside tip, go a little bit deeper than that. See, in this, they won't have the entire formulary. The formulary is the entire list of drugs and where those drugs are covered into what tier. Now, they'll tell you what the tiers are going to cost for the new year, but they won't necessarily tell you where those drugs will fit in what tiers in the new formulary. Now, again, we've got a detailed breakdown analysis of what we think are the biggest changes happening with certain companies. You can find that on our drug plan site. You can even change your drug plan over at startpartd.com. D as in drug. Startpartd.com. It's a direct-to-consumer, which means Medicare has approved that site to go right to you and explain everything that you need to do to change your drug plan. You can do that right there on that site 24 hours a day. You don't need to speak to an agent. You don't need to talk to anybody else. You can go there, put in your zip code, see what plans are available, see what fits you best with your particular situation, with your drugs and your pharmacy and everything. Then you can simply sign up for a plan. And anything you do, again, during the annual enrollment period, that's October 15th, ending December 7th at midnight in your location, will kick in then January 1st. For most everybody, you've only got one chance to do this. Whatever is last in December 7th is going to kick in January 1st. So a little insider secret here, if you get started early, and a lot of people run to the finish line really quick, you sign up for a plan on October 15th, but then you decide, wait a minute, I heard about another plan from somebody else that may cover me better. You go to a website like mine, startpartd.com, and you find that that plan covers you better. It really does cover you better than what you had last year and what they're proposing to move that plan to this year, because there's a lot of changes. Some of the plans from last year are going from $9 or $10 a month to over $80 a month. It's critically important that you look at your plan for the new year. Every year we have dozens of people that call us, never heed this message, and they say, well, it was cheap last year. I thought it was going to continue to be cheap this year. It may not be. We have a lot of disruption in this marketplace right now, especially on the drug plan side. We had a lot of consolidation from different companies. This year, one of the carriers is going from 6 plans down to 3, and they're crosswalking. That means they're moving you from what you had to what the new plan will be that they got approval for. And you might not even know it if you don't read your notice of change. So again, if you sign up for a plan early, then you find something that's better for you, you can do another application up to December 7th at midnight. The last plan in, December 7th at midnight, that's the plan that you're going to stick with for January 1st. So if you've made a mistake, you did something wrong, don't fret, don't worry. You can still do a new application. I would give it a couple of days to make sure there's some time lag between them so they can clearly see this next application was done after the fact. Then you're okay. It'll go through to Medicare. It'll kick out the first one. It'll last with the second one, and then you're good for January 1st. So I want to talk about a couple of things. If this year, and this happens every year, we have a lot of people who were on original Medicare, any doctor, any hospital, anywhere in the country, no networks, anybody that accepts Medicare you can go to, they're on original Medicare and they had a Medicare supplement. Some people had the same Medicare supplement for 15, 20 years and they never shopped that plan. And those rates, they're always trying to undercut each other and they're always trying to race to the bottom to get the better rate for people, for new customers. It's just how the business world works. So if you've not shopped your plan in 5 years or more, you may be thinking, I just can't afford this plan anymore. This Medicare supplement is unaffordable. I'm going to go for one of those TV commercials with the big celebrities who are about to get slapped, by the way. I'm going to go for one of those plans that they keep talking about on TV. I'm going to call in there and I'm going to get me one of those zero premium free plans and everything's going to be great. Just want to caution you on a couple of things, and that's great if that's the decision that you've reached. You are going to give up a couple of things. I encourage you to read the information that's on our website called allaboutmedicareadvantage.com. It's truly an unbiased research into what's going on with Medicare Advantage, true life examples of what's happening, what the Office of Inspector General with Health and Human Services and Medicare are saying about the plans. And I just want you to have your eyes open to more than a sales pitch. Now, in my office, to be balanced, we do Medicare Advantage plan enrollment. We do them every day. We do Part D drug plan enrollment. We do Medicare supplement, Plan G, Plan F for older people that could get it still, and Plan N. We do those all every day. So we see the good, the bad, and the ugly of all those plans. I want you to go into them, though, with not just a sales pitch, but with your eyes wide open. Things that you have to look for. Is there a network limitation? If there is, what happens if you go out of the network? Is everything covered at absolutely nothing? What happens if you need a referral to a specialist and you don't get one? Could you go anyway? And if so, do they cover anything? Of particular concern of me and my family, and a lot of people around the country, look at what the benefit is for cancer treatment on that or any other plan. I know what it is on Medicare supplement because that's the same from Virginia to California. Medicare supplements are exactly the same. They're standardized from Florida to Washington State. A Plan N is a Plan N everywhere. Same thing. Everything's covered, right? Any doctor you want to go to that accepts Medicare. Every Medicare Advantage plan, however, is different. Every single one is different. It could be different from one county to the next. I'm in Charleston, but if I go to Somerville 5 minutes from now, it's a totally different plan. Totally different plan number, benefits, and everything. Network, all of it's different. So pay close attention to the worst case scenarios. That's what insurance is. Look at your Medicare Advantage plan, the summary of benefits, and zero down into chemotherapy. Inside tip here, what happens if you have to have chemotherapy? If it says that your part is 20%, just understand, and I've done lots of videos on this you can watch on our channel. This most important part is understand that if they say that your cost is 20% until you hit your max out of pocket, and then January 1 that resets and you'll have to hit that max out of pocket again, that means that that cancer treatment is covered to the extent that they approve it. So they have to approve you in the network, approve you for the referral for the specialist that you need, approve you for the treatment center that you may be going to, have prior authorization before you have any expensive treatments done. That's another facet of Medicare Advantage. And once you get all those things approved by them, then you still have to pay 20% of all the cost. And 20% of chemotherapy cost is very, 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 very expensive. So then as you look at that max out of pocket that they tout in front of you, whether it's $3,600 or $7,000 or $9,000, whatever the maximum out of pocket is that they're showing you, you will hit that if you have cancer on a Medicare Advantage plan. Just assume the fact that you're going to hit the max out of pocket. So if you are on a very inexpensive or absolutely no premium plan, please take the difference that you would have paid for real insurance like a Medicare supplement plan and put that in a cookie jar somewhere. You have to put that money aside somewhere for these rainy days. Now those plans, the Medicare Advantage plans, are pay-as-you-go plans. You go in the hospital, it may be $100 or $500 or $750 per day. So you need to look very carefully at what those benefits are. And yes, I know it's a worst case scenario if you've never been sick, if you've never been through a prolonged illness like these that happen a lot with our people that are 70 and above. But just look at a worst case scenario and look at the restrictions that you'll never discover until you need to, and by then it's too late. That's the other thing about it. If you do consider leaving your original Medicare and a supplement, going to Medicare Advantage this year, understand that you may not get that plan back. Typically, when you leave a Medicare supplement plan, you have 60 days to go back and get that plan back. When it's gone from that and that's over with, you would have to then go through health screening questions in most all states, not every state, but most all states. You have to answer health questions to get back onto a Medicare supplement. Now, could you go back to original Medicare and have no protection whatsoever and have unlimited exposure to 20% of all your outpatient expenses on Part B? You could. Bad idea. You need to have something underpinning your original Medicare, whether it's a Medicare Advantage plan or a Medicare supplement. You need to have something. And your ability to upgrade later to a Medicare supplement may not exist, depends on your health. What we see to happen, and I'm just sharing with you worst case scenarios because that's what we hear a lot of. Someone will go to a Medicare Advantage plan. Every year they'll fall for a commercial. They'll see the high level, but they don't see the small print. They leave their Medicare supplement behind because they thought it was too expensive. Then they have an event that happens within that first year, hospital day, hospital charge, and then recurring co-payments, and then limitations and struggles with the network, because doctors can leave those networks anytime the doctors want to, but you can't leave that plan anytime you want to. Then they reach out and they say, I was diagnosed with this, or I had a cardiac event, or I had this diagnosis, and I want to come back to the original Medicare where I can go anywhere that I want to go, and I want that supplement back where I have either a tiny copay or no copay whatsoever, and I go in the hospital and it costs me nothing, and I can go to any hospital that I want that accepts Medicare. It just doesn't happen that way. With all the ones that we've seen, when you give up original Medicare and you go into the private world of Medicare Advantage, where they're dictating what you're going to get for treatment, and they're dictating where you're going to get the treatment from and whether or not they're going to approve it or not, then when you figure out the worst case scenario when that stuff happens, it's very, very difficult to get back into a Medicare supplement. We'd be happy to walk through those pros and cons with you. Medicare Advantage plans are changing. They're changing a lot over the country. That's another facet of them. I mentioned to you before the annual notice of change. That's what you get in your mail, usually before October 1st. You should have had that already. In the notice of change, you'll see copays change, networks change, sometimes hospitals change. The formulary and the drug plan, which are sometimes embedded within the Medicare Advantage plans, those things will all change on you, and they're allowed to. They can vastly change those plans every single year. Remember I said before, if you have a Plan N or a Plan G Medicare supplement, whatever contract that you bought that under is going to stay locked in. 20 years ago, we were selling Medicare supplement Plan J. Now, they don't sell Plan J anymore, but if you had it, all the benefits that you had back then, which are great, are still in effect today. It's locked in stone. So your Medicare supplement plan will not change the benefits that you have. The Medicare Advantage plan, absolutely guaranteed, will change some form or fashion. Some facet of it will change every single year, and it's incumbent upon you to understand what those changes are. So I've seen a lot of gravitation from HMOs, which are restrictive networks, and that's how they save money. That's how they can give you those plans at so little cost every month. Have you pay when you go to service and have a restriction, a tight restriction, and a management of your health care, so that if you want to go get an expensive treatment done, not want to, you have to, your doctor says you need it, you first must obtain prior authorization from the health plan. And typically what they'll do is they'll go for the cheapest amount of treatment first to see if that solves it. What we often see is doctor will recommend an MRI. The health plan will say, you don't need an MRI, let's do something cheaper. Let's start with a chest x-ray. Let's start with an ultrasound. Let's start with something cheaper. Meanwhile, the time is ticking by, and whatever the underlying course of ailment that you had is not getting any better, because you really could have gone straight to the MRI had you had original Medicare and a Medicare supplement. The Medicare supplements don't decide what treatment you get. There's no brain in the Medicare supplement world. They just piggyback on top of original Medicare. So if original Medicare says, yes, this is medically necessary, yes, you're going to a Medicare provider, then the supplement kicks in and it pays it. So that's very simple. Those things are different in the Medicare world. So what we're seeing a lot of people do, they're going away from the traditional HMOs in the Medicare Advantage world into a PPO situation. And many of the PPOs out there will have an in-network component to it, where the costs are cheaper. Then they have an out-of-network component where you can literally go anywhere you want out of the network of a Medicare Advantage plan. That does sound great, but then your max out of pocket is over $10,000 in many cases. So just generally speaking here, if you're going outside of the network on a Medicare Advantage plan, typically if you're on an HMO and you go out of the network, there's no coverage, you're on your own. You don't fall back into the red, white, and blue Medicare card and say, wait, I'm outside of your little network, so I'm in original Medicare, right? And Medicare is going to pay 80%, right? And I'll just pay the 20%. It does not work that way. When you sign that little piece of paper and you say, I'm out of original Medicare now, for this year I'm going to go into a Medicare Advantage plan, that plan is solely responsible for your care. Original Medicare is basically on the back burner and waiting there, and it cannot kick in and help you right now because you've signed that benefit away for the privatized health care. So if you're on an HMO, a typical HMO out there, and you go outside the network, you do a course of treatment that they say is not authorized, that prior authorization didn't happen, you could be looking at exposure of 100% out of your pocket, not even with the protection of the maximum out-of-pocket benefit that you have under those contracts because you went outside the network. So on the PPO plan, excuse me, on the PPO plan, what we're seeing is there is an option to go out of the network. Your costs are higher, but what they don't tell you in the small print is the doctor must agree to accept and bill that insurance company. So if he's out of the network, he might be not participating in that network for a particular reason, right? So you have to get that doctor to agree to accept the fee schedule and to bill that company. Not all doctors will. Just because your health plan has an out-of-network provision like a PPO will or an MSA will does not mean that every doctor out there is going to accept your private health insurance card. You need to know that in advance. So if you're signing up for a Medicare Advantage PPO plan with the understanding that I can go anywhere I want, if you have somebody in mind, you better go reach out to them and say, hey, if I go to this plan, would you agree to bill them for me manually? Something to keep in mind. Now, what's going on in Medicare Advantage? The problems are still occurring with the prior authorizations. There was a bill proposed in the last 2 years to solve that. It went nowhere. So those prior authorizations are still being routinely denied. Referral requirements are still there. Courses of treatment that look like they're the lowest cost as opposed to the most effective, those are still happening. And here's the latest. All those celebrities that you've been seeing on TV that are pushing Medicare Advantage, and they're saying things like, you can have free transportation. We'll pay for your meals. We'll pay to give you a ride to your doctor. We'll pay you, we'll get an air conditioner for your house. Many are doing that or saying that. We'll give you all these benefits. CMS, which is the enforcement arm that manages everything having to do with Medicare, they're finally coming down with some restrictions on those advertisements because those are general advertisements, again, talking to the entire country, talking about specific nuance plans that are scattered throughout the United States. But they make it sound like if you come to their plan or call them for a plan, you're going to get all these different benefits that may exist in, Spokane, Washington or Jacksonville, Florida, but they've taken all the cherry-picked benefits, put them all together into one commercial, and given the illusion that if you get on their Medicare Advantage plan, you're going to get all this panacea of benefits. It just doesn't work that way. So finally, the enforcement arm of CMS has finally come out and said, you got to stop that, knock that off. So hopefully there will be some teeth behind their latest enforcement memo, and these companies will knock that off, giving misleading information to seniors just for the sale, just to get somebody to call in. And I used to grow up where I was told that was called the bait and switch. You tell them all this wonderful stuff, and then when they come in, it's like, oh, well, that's not available in your zip code. Sorry, but what I can do is I can put you on this great plan. Let me just get a verbal authorization, and poof, you're off of Medicare. You're on the private insurance plan going forward. And again, it may not be possible for you to get back onto original Medicare with a Medicare supplement if you follow that route. Please be careful when it comes to the commercials on television. They may have nothing to do with your location, where you are, may have nothing to do with your doctors, your illness, your income, and all that. They've just lobbed all those things in there and told you that you can have everything. And hopefully those are going to come to an end if Medicare can get out there and do some enforcement. So if you're on original Medicare, you've got a Medicare supplement, you don't have to do anything this year. We have thousands of people that call our office every year during this period of time, because if you go into a restaurant anywhere, you'll see Medicare commercials all on the wall. They're everywhere on every television, Medicare commercials all over the place. They think, oh, well, now's the time that I've got to change my Medicare supplement. It is not the time that you have to change your Medicare supplement. As a matter of fact, if you want to get on our calendar for December 8th, 9th, 10th, 15th, 20th, January 1st, January 15th, any time of the year other than this crunch period of time where there's just a limited finite number of days and calendar hours and employees that we and everybody else have, we've got to focus right now on Medicare Advantage stuff and Part D drug plan stuff. The Medicare supplements we can really do any time of the year, and I'd appreciate your patience on that. However, you do need to look at your Medicare supplement. If the reason why you want to leave your Medicare supplement is because it has become unaffordable, then yes, we do need to shop that plan for you. We just don't have to do it during this crunch period of time. But we can shop the plan and get your rate down and get you through underwriting. Just understand it's not just our agency, it's every agency that has anything to do with Medicare or Social Security is completely overwhelmed and jam-packed this season of the year. So that means the underwriting departments at the insurance companies, doesn't matter which insurance company, they're all going to be backed up. We've done a lot of things and improvements in our agency over the last year to try to streamline those processes so we can help more people than we ever could before. We've introduced technology that allows us to find spots on the calendar and insert somebody into that spot and keep all of our appointments and remind people the appointments. It's gotten a lot better here. But again, I'll ask you, if you're going to do a Part D drug plan, the best thing you can possibly do is go to startpartd.com and do it yourself, because it is simple enough to do that. If you're having trouble with that and you're our client, then you can ring us on the phone or fill out our form and we'll get you on our limited calendar so we can go through the drug plan with you specifically. If you're not our client and you don't have any insurance with us, we can't do that manually with you because we have a limited number of employees and limited slots on the calendar. You can use our tool, anybody can, at startpartd.com, but beyond that, you might have to go to Original Medicare folks at 800-633-4227 to get your drug plan done if you're not a client of ours and you need somebody to walk through the drug plan with you. If you're going to do that, I'd encourage you to call Medicare late at night because they are a 24/7 operation, and most people think that they're just doing business hours. All that out of the way, important warning here. Whichever plan you sign up for, if you're doing a Part D drug plan this year, and I do think even if you were happy with your plan last year, you need to affirmatively go out there and proactively look at the plans for next year. They're different. They're very, very different. And you can't just expect the one that you had last year to be the same one you had this year. No matter what plan you sign up with, if it's a standalone drug plan, most all the companies in the market that do drug plans also have a side of their house that does Medicare Advantage. Okay? They'll do an HMO or a PPO or MSA. They'll do a Medicare Advantage side. What they're trying to do, and this has gotten worse over the last few years, they'll take you as a drug plan consumer, maybe paying $5 or $6 a month now, this year, and they'll call you on the phone and say, look, you're paying this monthly premium for a drug plan, right? But if you like our company, why don't you come on our all-in-one, all-comprehensive plan over here? They won't call it Medicare Advantage. They'll say, why don't you come into our comprehensive plan where we have the drug plan included, but there's no premium. It's no cost at all. It's amazing. It's a miracle. It's magic. And they'll pick off some folks that don't know better, and they'll get from just a standalone drug plan into a comprehensive, giving up original Medicare Advantage plan from which they may never recover. If something goes bad, they want to go back to their Medicare supplement. You cannot have, it's illegal to have both a Medicare supplement and a Medicare Advantage plan. You can't have both. So when the person who has a standalone drug plan and their supplement and they're happy with that, they will get a phone call from the drug plan company. You can just bet your bottom dollar. They're going to get a call saying, why don't you come to this bigger plan with us at no premium? And us, we the agent, can't do a thing about it. They take advantage of a law under the terms of the Telemarketing Act, where it's an existing business relationship. So they're allowed to call you. Even if you're on the do not call list, does not matter. They've got an existing business relationship with you because you have the drug plan, and they're going to try to upsell you over to the comprehensive plan without necessarily telling you that your Part A and your Part B are no longer in effect, as far as you can't just go out there and show a doctor your red, white, and blue card and have treatments done at any provider in the country that accepts original Medicare. Those plans typically will have a restrictive network and all the rest. So please be careful. Look for the upsell. If you have a standalone Part D drug plan, regardless of who it's with, even if you didn't make a change, look out for that upsell. Now, at the top of my website called startpartd.com. I'm going to give you some resources. If you have something to write with, please write this down. I'll give you a second. At the top of our page, startpartd.com, we've done a thorough analysis of the companies that we've decided to contract with and work with this year. So of those plans, they're having significant changes. And you can look at the document at the top of our page. It's not a sales document. It's not trying to convince you of anything or move you from anything. It's just an internal analysis of what we've seen change through these different plans. And if you're on the plan, please look at that color-coded section of the plan that you're on and see if that change affects you. It's going to affect millions of people, and this is a high-level overview, not a sales trick at all, trying to get you to do something. Stay with whatever plan you want. This is just looking at, high-level, what's happening with changing on those plans. You need to look at that, if nothing else, at startpartd.com. Now, that's not a comprehensive list. You may have a plan that's only regional or just available in your state. We've not looked at all the plans entire country wide. These are the big plans, and you need to know what those changes are. So that might help you. Again, that's at startpartd.com. Quick good news was announced that Social Security cost of living adjustment for 2022 is going up. What does that really mean? According to Social Security, and I've got that notice on top of our page I'll give you a resource for in a minute. The average retiree before this increase was making $1,565 a month. That's the average across the country. The new average after this cost of living adjustment will be $1,657, an increase of $92 a month. Now, a recent analysis from Moody's Analytics showed that because of recent inflation that's been happening in 2021, the average American household with $70,000 of average median income, whatever it is, that's gone up in their cost every month of $175 a month, just from inflation, just from the cost of food and gasoline and things that you normally buy in the house. So if the average cost just due to inflation has gone up $175 per month, this $92 increase from Social Security may not be that great. Also, make sure you understand that in November 2021, we're going to have the numbers for next year, for 2022, as far as your Part B premium. That is expected to go higher. That's just to be on Medicare. Oh, little caveat. If you choose to get off of original Medicare for all your treatment and a Medicare supplement, and you go into one of these Medicare Advantage plans, just keep in mind you still have to continue to pay your Part B premium to be on Medicare. That's the biggest confusion that's out there. They'll say, well, it's zero premium. Why am I still paying this $150 or $160, whatever it's going to be, to Medicare to be on Part B when I can't use Part B? I've given that up now for this HMO that's supposed to be no premium. Your salesman should have told you that you still have to keep your Part B of Medicare just to participate in the Medicare Advantage program. How weird is that? You get to pay for something of which you don't get the benefit for it. It's interesting. So the point is, why continue to pay for a high premium Medicare supplement when we in our office every single day we're saving people money from their old plan to a new one, saving them from $50 to as high as $300 or $400, literally a couple last week, $400 a month we saved them. Same benefits, same doctor, same hospital, same everything. That's what I've been doing for over 20 years, putting people on their plan to the better plan that's in the market. My service doesn't cost anything. Our office does not operate on charging fees for people. We just put them with the best insurance company for them. That's something we do all the time. So I want to talk through two processes that you may want to do. Going from a Medicare Advantage plan to a Medicare supplement. Let's say you went off on a Medicare Advantage plan first, or you're on a Medicare Advantage plan right now, and you're saying, look, during this annual enrollment period, I want to go back to original Medicare, and I want to pick up a Medicare supplement so I've got the freedom and the flexibility, and no one's controlling my health care except me and my doctor. I want to go anywhere I want. I want to travel without restrictions and all that. Happens all the time. There's a couple of things you need to do, and you have to do them in order. So I'm going to address that real quick. You're on a Medicare Advantage, and you want to go to a Medicare supplement. First, you apply for the Medicare supplement. Don't do anything else. Don't go cancel your Medicare Advantage plan yet, because you may not be approved at the supplement. So first you apply for the supplement. If and when that approval is given, then and only then, we help you get a Part D drug plan. Now, when you get a Part D drug plan, it cancels out that one slot that you have with Medicare, taking away your Medicare Advantage plan, replacing that with a standalone drug plan. So again, apply for the Medicare supplement first. Usually it's an underwritten application. We ask you health questions. Once you get approved, only when you get approved, then you get the drug plan, which will start either on the 1st of the next month or January 1st, whichever applies to your situation. We can help you with that. We do it all the time. The second one, scenario, going from a Medicare supplement to a Medicare Advantage plan. If you think that the times are right and the benefits are too great, the commercials are wonderful, you want to go to one of those Medicare Advantage plans, we can help you with that as well. And the process is you need to consider a few things. We're going to, in full disclosure, as opposed to many places I know about, we're going to tell you about the network restrictions. We're going to make sure that you see the report from the Office of Inspector General that said that 75% of denied procedures with Medicare Advantage are ultimately overturned. So we're going to tell you how the appeals process works in case that happens to you, because it happens a lot. Once you know those things, we're going to look at the network for you. We're going to look at your drug plans, look at their formulary, and help you get matched to a plan that's most cost effective for you. Then you sign up for the Medicare Advantage plan during this annual enrollment period. And again, that ends at December 7th at midnight. Then on January 1st, you'd have a cancellation of your Medicare supplement because you would no longer need it, and that's gone. And you'd go into your Medicare Advantage plan for January 1st. So we'd also want you to consider possibly a PPO plan, so at least you have an out-of-network option for you. One last thing, and then I'll give you some resources to write down. I know your hand's been getting tired there waiting to write something. Please, 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 please be nice to everyone that's in our industry this season. Whether you use my agency for your Medicare insurance or whether you use somebody else, one of my competitors, one of my friends, one of our downline agents, one of our trainees on Medicare agent training, whoever it is, please be nice to these folks. I can tell you, it causes a lot of gray hair. You can see a lot, right? Causes a lot of gray hair. Some of it I hide sometimes. It causes a lot of stress at home for a lot of my people. There's not much downtime. We're working late nights, we're working weekends, we're working all the time. There's no vacation time. People get sick and they still continue to work. Our people have the option of working from home when those things are happening. They're juggling, in our case, our people are juggling childcare issues, lack of time with spouses. Also, they can sacrifice and be there for our clients and our potential clients when they need us the most, which is now. Please bear that in mind and have patience with us. We have a phone system that always gets overwhelmed this time of year. We're doing the best that we can with technology and with personnel. It's difficult to ramp up to what we could probably take on 6,000 employees for the annual enrollment period, get them all trained, certified, licensed across the country with all the Medicare Advantage plans, the Part D drug plans, the Medicare supplement carriers, all the stuff that's involved. And it's a lot getting ready for this season. Then to have them sitting around and doing nothing from January to waiting to that time of the year when everybody thinks that they have to do everything all at once. It's overwhelming. So just please have patience with us, with the insurance companies, with everybody involved. A couple of resources for you. Oh, by the way, if you're turning 65 and you're in your initial enrollment period, we can still help you during this period of time. Again, just please have patience with us as we're fitting that in. If you're just doing a routine renewal, just looking at your plan to see, hey, am I on the best plan? I renewed in, October, November. We have tried in our office to reach out to all those folks earlier in the year, a couple months ago, to look at whether we should change or not. And really, now is not the best time to get in there for a routine checkup on your plan. We can do that, but it's really a bad time to do that because we're trying to crush and triage everybody that has to have something done right this minute. And you can book a time with us, like I said before, December 8th or the week after this crazy season ends, because we can change your Medicare supplement any time of the year. Please keep that in mind. Updates are coming, lots of updates coming with Medicare. Things are changing all the time. So I encourage you to keep a subscription going on our YouTube channel. You can find that from seniorsavingsnetwork.org/YouTube. Real easy. seniorsavingsnetwork.org/YouTube. Give you the option of subscribing. Hit the notification bell so you get an email when there's something new about Medicare that may directly impact you. And also the updates on what's going on with the cost for Medicare to be announced, changes with Social Security, changes with a lot of the drug plans and things that are happening. You can get those at seniorsavingsnetwork.org/update. seniorsavingsnetwork.org/update. And that's going to be constantly updated as the things are announced. So we're here for you. We don't charge anything for our service. We just ask for your prayers. We ask for your well wishes as we go through this very, very, very trying time of the year. We've had a lot of improvements in our office, like I mentioned. We've got some new staff. We've got some new capabilities. We've got some new partners. Things are going very well. I'm just on the front end of it as I film this now, looking at all the things that we have in front of us, and it's going to be a very daunting task. We are up to the challenge. We are rested. We are educated. We're up to date on the plans. We're up to date on how we can best help you. I just ask for your patience, because what is normally a well-oiled machine, and we do write insurance every day of the year, well, during the business days of the year. We help people with Medicare supplements and changing them all year long, or Medicare Advantage if they're new to Medicare. But this is the time where all that stuff just comes into a crescendo at this time of the year. Medicare supplements, not so critically important time-wise right now. Medicare Advantage and Part D drug plans are filling our calendar for this period of time because it's the only time we can do it. Updates will be coming. Please stay tuned. God bless you. Thanks for being a part of what we're doing. If you're a client of ours, I just want to thank you so much for trusting in us through these years. Thank you for your patience as we've been growing and improving our service here. Thanks for being along for the ride. Nicole and I and our entire staff are so thankful for you, for your viewership, for your camaraderie, for your well wishes, for your cards, for your thoughts and prayers. We really appreciate it during this time of the year and all the time, as you've really made a huge impact on not just us and our family, but the people that we're able to help because of people like you. So thank you so much. Talk to you soon. Bye-bye.
Where HMO insurances tend to fall short is when people come down with a complex illness like cancer. And I'm a prostate cancer specialist, so I see the dichotomy of the way people with HMO insurance are treated and the way people that have private insurance are treated. And there's a big difference. The people who have private insurance have a lot more discretion on choosing their doctors. The treatments are generally better funded, and there's just broader access to better care. So I mentioned that Medicare functions sort of like private insurance, but many people do sign their Medicare over to become a sort of an HMO insurance. They'll get some additional benefits for drug coverage and whatnot, but once again they will be restricted in the physicians that they can see, and you'll need pre-approval for perhaps some of the more expensive treatments, whereas with general Medicare, your doctors and you will have a broader free discretion about what kind of treatments you get. So there's a lot of choices out there, and in particular in prostate cancer, because the majority of men are over age 65. This choice between getting a prepaid Medicare type HMO versus holding on to your regular Medicare could make a difference in the quality of care that you can access with relative ease, as opposed to having to fight your insurance company to get the treatment you want.